My name is Anna Kelly, and I would like to thank Dr. Proctor for his comprehensive review, and I would like to thank Susan for her transparency up here today. It's very brave of her. I'd like to thank the Interstitial Cystitis Association for inviting me to speak today. It's truly a pleasure to come together in fellowship like this and talk about my passion, which is acupuncture and Chinese medicine. I'm having a little bit of difficulty talking because it's freezing in here. I told my daughter my mouth is stiff, but I'll try to warm it up and be as clear as I can. What I thought we would do this afternoon, and thank you for your attention, what I thought we'd do is review a little bit about acupuncture and some of the terminology that you'll hear in the acupuncture world. We'll compare acupuncture to Western medicine. We'll talk specifically about what is interstitial cystitis from a Chinese medicine point of view, and then we are going to do a demonstration on someone this afternoon. I'm trained in Western medicine, and I was practicing anesthesiology pain management through the 90s and into the early 2000s, and simultaneous with that, I was practicing medical acupuncture since 1999. And after a few months of practicing both side by side in my practice, I noticed that almost all of the acupuncture patients were better in significant ways. Their pain was better, their sleep was better, their mood was improved, sometimes their relationships were improved. Acupuncture is truly a holistic and integral therapy. Acupuncture is the relatively painless insertion of solid needles into various parts of the body. Now, you have to get used to in acupuncture that most of the time the needles are not going to be where you think they're going to be. So for back pain, I usually don't put the needles in the back. For pelvis pain, I usually don't put the needles on the lower abdomen or on the pelvic floor, on the perineum. For headaches, we'll frequently put the needles in the feet. So we are listening to your story. I think Susan described herself as a piece of art. She used some sort of metaphor. And so when a patient comes to me, I'm listening to all of their symptoms, and I'm figuring out what flavor, if you will, of interstitial cystitis they have. And then we're putting the needles in very specific to that patient. So there are not treatment protocols for bladder pain in Chinese medicine. The treatments are very much individualized. Now, why doesn't acupuncture hurt? Well, the needles are very, very thin, around a 38 gauge needle, very thin, smaller than a tuberculin needle. The needles are solid. They're not hollow. They don't have a hollow center. Also, they're pencil point in shape. They're not beveled like a hypodermic needle. And the other reason they're typically not pain, there's no pain upon insertion, is that they're tapped through the skin very quickly. And many people have fear about the needle, and then after I put the needle in, oh, is it in? Is that all? So I would say 90% of the time there's really not much sensation at all other than me touching your skin. First of all, I want to say the NIH is taking an increasing interest in complementary and alternative medicine. And the term complementary and alternative medicine can be a bit offensive to those who practice acupuncture because it's actually, traditional or conventional medicine. And I find it fascinating that whatever culture in the past 3,000 years has embraced acupuncture, it's been able to serve that culture. So in the early 1970s, Nixon made a trip to China, and James Reston, who was a New York Times reporter during that time, some of you may remember this, he had an emergency appendectomy over there. And for post-op pain, so he was in a hospital where they do both Eastern medicine and Western medicine. So he had a surgical appendectomy. And for post-op pain, he had acupuncture, and it very successfully relieved his pain. He came back and wrote an article on it in the New York Times, and since then, before then, practitioners had been practicing under the radar, so to speak. But since that time, there's been an increasing interest in both the Western community and some governmental agencies such as the NIH to say, what is this? How does it work? How can we incorporate it into what we consider to be conventional or Western medicine? So there are hundreds of studies that the NIH is doing looking at anything from asthma to irritable bowel syndrome to interstitial cystitis. And there's also a lot of reports out there that show that acupuncture doesn't work at all. And we have to ask ourselves, why would that be? I've devoted my full-time practice to acupuncture since 2002, part-time since 1999. So why would I do this if it didn't work? So I want to say, number one, in my experience, it does work. And number two, if I set out to prove that it works, if I did this half of the room, if I treated y'all with acupuncture and Dr. Proctor treated y'all with medicines, it would be a very difficult study to do from a technical point of view, because there's 30 people on this side of the room and 30 different needle patterns that would need to be administered. Well, in Western medicine, we like to have, when we do blinded studies, they're either on drug A or they're on a placebo. But we're not willing in the West to say, just let acupuncture be the modality that we're comparing. They want to tell me what specific points to use for bladder pain. So it doesn't honor the individuality of the medicine. So a lot of the studies you see are going to be case series or case reports or experiential studies without controls. So that is the limitation of trying to fit something as integrative and holistic as acupuncture and Chinese medicine into this randomized, double-blinded trial gold standard that we have here in the West. It just doesn't work. You're asking a paradigm that's holistic to fit into a reductionistic point of view that considers that the body is a machine made of replaceable parts. This is a list of on slide 119, you'll see a list of just a few things I picked out. Acupuncture treats migraines, it treats Bell's palsy, it treats hypertension. Acupuncture, interestingly enough, can turn a breech presentation baby. There's one point actually on the bladder channel on the side of the pinky toe that when a needle is applied or when there's an herb applied in a technique called moxibustion, about 60% of the time the baby will turn. And this prevents C-sections and the need for external rotations, which can have side effects. The issue is if you keep doing acupuncture in these patients, the baby can turn back. So one thing I tell my patients, if you feel the baby turn, stop doing the acupuncture and moxibustion. Now, about 3 or 4 studies have come out and have been published in the Journal of Urology in the past 10 years looking at percutaneous electrical nerve stimulation or electrical stimulation in IC patients or male patients with chronic prostatitis. And they've shown that, and the studies were all small, 20 patients or less, but they did show a positive result with percutaneous electrical nerve stimulation, which is a specific style of acupuncture in chronic bladder pain or pelvic floor pain patients.